eyes might help predict heart attacks, study suggests. Eye exams cannot be underestimated. People need to get their eyes checked for anomalies, especially those prone to cataracts, glaucoma, and similar conditions. But besides eye health, eye exams have a chance to uncover something odd in your heart. A new study suggests that such exams may help predict a heart attack. There are many types of eye exams to detect different eye problems. One type is the retinal exam or ophthalmoscopy used by doctors to check the back of your eye. The exam usually reveals the happenings on the retina, optic disc, and retinal blood vessels. To start, the eye doctor needs to dilate the pupils with eye drops. This is to prevent the pupils from getting smaller once exposed to the light, which the doctor will use during the exam. While retinal exams are meant to check the retina, they may also see something else about another organ. According to researchers at the University of Edinburgh, routine eye screening combined with genetic and demographic data could give insight into a person's heart health and risk of illness. This is huge for those who frequently go for regular eye checkups. Although scary to know, it gives them a warning before it's too late. Presented at the European Society of Human Genetics, researchers showed that studying the branching patterns of the retinal vasculature could offer insights into human health. They used a measurement called fractal dimension from the UK Biobank data of over 500,000 people in the UK. Then, they created an AI model to predict the risk of heart attack using retinal images from those who already experienced such an event. Adding genetic factors further refined the model. Researchers applied 9 of many genetic regions linked to vascular branching patterns. Of that, 4 were known to be involved in cardiovascular disease genetics. The factors alone could define how severe the heart attacks would be and the speed of recovery. Here's how an eye exam predicted heart attacks using a trained AI model. Remember that a retinal exam could look at the blood vessels supplying the retina? They appear as branching trees in healthy people. However, they look basic in some people. The iconic complexity is absent and the branching appears too simple. A retinal exam is still not the standard for diagnosing heart conditions. But if you're scheduled for an eye exam, you can ask the ophthalmologist if they see something odd that's worth further investigation. The eye is said to be the window to our soul, but researchers think it may also be a window to the heart. Have you had a retinal exam? Do you regularly get your eyes checked for problems? Share your thoughts in the comment section. Till our next video, thanks for watching.